now we get fall weather. Yay!
Yay! I know. I wore my
Goodness.
sweater today because I was so excited.
Oh my gosh, me too.
I know. I got the boots out. I wore boots this week. At least we
wore
get a little bit of
pumpkin
a
orange.
reprieve. I know. I like that orange on you. That's
Thank
perfect,
you.
especially
Yeah.
with the sunset behind you.
Yeah,
So
right. It matches. Color coordinated in the background.
exactly.
Okay, today we have Kenneth Dalebout. He serves as a Chief Administrative Officer for Arroyo Grande Community Hospital, where he oversees the strategic development of the hospital. Ken has more than 20 years of experience in the healthcare industry. His background encompasses operations, business development, strategy, and planning, and governance in both not-for-profit and for-profit healthcare organizations.
Ken has worked for a variety of notable organizations such as Dignity Health, USC Kenneth Norris Cancer Hospital, Memorial Care, and St. Joseph Health System. Ken holds a master's degree in business administration and healthcare administration from the University of Minnesota, Carlson School of Management, and a bachelor's degree from Brigham Young University in Utah.
On the Central Coast, Ken participates in the community by currently serving on the South County Chambers of Commerce, the Economic Vitality Corporation, and the 5 Cities Homeless Coalition Boards of Directors. Ken lives in Arroyo Grande with his wife, Angela. They have seen 3 of their 4 children graduate from Arroyo Grande High School, with 1 more working towards that goal.
Let's welcome Ken.
Welcome, Ken.
About what led you to choose healthcare administration as a focus in school and then follow that through in your career.
Okay, so it's my decision to do healthcare administration, somewhat logical. I started off as an undergrad thinking that I might want to go to med school, and had made that decision, and then for some reasons, I really discovered that I am not a very good bedside person. Like being a hands-on physician, I just realized that's not my strength, that's not my interest. I love the sciences. I took physiology and anatomy and all those classes, and did better than most of the pre-med students, but just decided that being a hands-on healthcare provider that's not me. And so really was kind of daydreaming one day and just kind of wondered, my strengths are kind of in management and business, but I really love the sciences, and I wonder if hospitals have managers, and literally looked in the phone book where I was going to school, and sure enough, there was an administration department in the hospital, and called the hospital and said, I think I want to do what you do. Can I come talk to you? And that's how it got launched. And so, so after undergrad, which was a totally unrelated major, I did a 1-year kind of self-found internship with a small community hospital, and then applied to graduate school. Went to University of Minnesota for a master's in healthcare administration program.
That's awesome.
So we toured the recently opened Matthew Will Memorial Medical Center, and we've watched the finish of the newly expanded ER. So exciting. What are the current improvement and expansion projects going on at the hospital currently?
So right now, we're kind of in a slight lull, in a sense. Like you say, we just finished the ED, emergency department expansion. We just did a complete renovation and reconfiguring of our inpatient pharmacy. The Will MOB is somewhat, MOB, medical office building, sorry, is somewhat complete. Some of the things though that are underway. One is we've just completed a cancer rehabilitation center that's in the medical office building, in the Will medical office building. And so that's for cancer patients while they're in treatment, and then afterwards to learn how to exercise and take care of themselves. And that there's, and I don't know the facts, or the specific numbers, but there is a dramatic decrease in recurrence if a cancer patient continues to exercise and do certain things. It's astounding what the reduction rate is. And so We've just built that out. We're about to go through licensing to get that approved as an additional service for our cancer patients in the Arroyo Grande Valley. On the second floor of that building, we're building out additional clinic space, so about 7,000 additional square foot of physician offices that are through our Pacific Central Coast Health Centers, which is our clinic model, employment model for physicians. We don't talk about it a lot, but we have over 100 physician providers in that clinic model. So those will be new additions to the campus. Future, we're looking right now at starting a philanthropic campaign to upgrade our operating rooms. It's been a few years, they're perfectly good, but we want to bring the level of the facility up to the level of skill of our doctors. And so we'll be doing that. And there's a few other little projects. We're still hopeful to put their MRI in a building under a roof, not in a trailer. Looking at a nutrition center. Right now, we're somewhat limited because of the cafeteria isn't open all the time, and so after hours, there's not a lot of food on the hospital campus. So we're trying to find some way to bring in some really high-end vending machines, self-service machines, to provide food for people after hours. So those will be rolling out over the next couple of years.
Very good. Well, thank you.
Okay. So how has the pandemic affected the hospital? What changes have you had to make in terms of providing services and also fundraising? Because I noticed you did a virtual fundraiser recently. So
yeah. So the changes, we're always ready and been very good at infection control, prevention, all that. So the idea of taking care of patients that have an infectious disease is not new or unique. It's always, the nurses and that have the same concerns we all have. I mean, no one wants to be infected, but they know how to protect themselves. And we have policy procedure down. Within a week or so of the pandemic being recognized, we had developed a hot, cold kind of scenario in our emergency department where people suspected of COVID would be put in one area, others in another area. So all that is, you can't say routine, but we're practiced at it. But the real change that happened to the hospital really impacted the patients, and that is that we went to a very strict visitor policy. And there were times when, for several months, where we had no visitors, except OB was one, and then end of life. So that was a real impact on even how patients felt like they were taken care of. And so we're back now to allowing one visitor per patient. And that really does help with a healing environment. And so we're slowly coming back out of it. The one thing that we have noticed is we used to have pretty much an open door, bring in everybody. And it's great when it's your family visiting, but everybody else on the hall sometimes had concerns. So we're probably a permanent, ongoing result of COVID is the idea that we're probably going to have limited number of visitors. We've just realized that actually does help the healing environment. So that's the biggest impact. Now, the cost of taking care of patients has risen. There's testing requirements. We do require more personal protective equipment. The hospital has gone through a phase of reduction of volumes. We stopped doing surgery for a while, except in the most urgent or emergent basis. So you look at kind of half the hospital, and we didn't use that for several months. So you talk about fundraising. We, like many companies, have had a very significant decrease in our revenue because we just haven't seen as many patients. but during this whole time of COVID, we didn't let go any employees. We've kept all of our employees. Now some of the clinical people flex with volume. You know, if there's 10 patients and that typically takes, you know, 3 or 4, I shouldn't say, if you have 50 patients and that typically takes 20 people, if you have 10 in the hospital because you're not doing surgeries, we don't have to have as many, but we didn't let anybody go. We didn't furlough anybody. So we've maintained all those costs during this time because we want to make sure that we're ready. And 2, it's just the way we treat our employees. So we've had financially some really rough times. And so we did some fundraising for emergency services, not emergency, but emergency COVID funding to help fill that gap so we can continue to provide the same level of care.
Yeah.
But, you know, the needs of the hospital are still there from a philanthropic. And so we actually are going to be starting a new $2 million, actually the campaign is about $1.5 million. We hope to spend about $2 million on surgery.
Yeah. Nice.
Well, you kind of touched on this, but in the media, they've talked a lot about the PPE supplies and getting that, and respirators and all that, getting that across the nation has been a struggle. I'm sure it's increased your cost, but did you struggle getting any of those supplies to the hospital or to your nurses? Was there any struggle there?
So we felt the same kind of constraint with PPE as other places.
Right.
We were very, very proactive in the beginning to identify new sources of PPE, and we're very aggressive in making sure our orders came in. And so there's never been a time during this pandemic where the hospital has been had a shortage of PPE that could be used at the time. Now, there were times when we put into place conservatory kind of measures to conserve it, because if there was a surge, we wanted to make sure that we could maintain appropriate levels. So, you know, we talked a lot about how to conserve PPE, but there was never a time when we didn't have appropriate personal protective equipment for all of the staff. We don't have a confirmed case where one of our staff contracted COVID from a patient.
Yeah,
We've
that's
had
impressive.
employees.
Amazing.
Yeah.
Yeah, now there's employees that have been tested positive. They may have gotten it at work, but we can't directly do source tracing to say, yep, this patient and you were the nurse for that patient and you got it from, you know, you were in the hospital when we had positive COVIDs and, you know, it could have happened. But so I'm just saying, so from a safety standpoint, I can say our staff have been very, very safe. Respirators, we actually did order some early, you know, respirators and that got diverted.
Yeah.
That never showed up, and federal government diverted those to places where they thought the need was greater. And so some of that did happen. Now it goes back to, did we ever have a time in the last 7 months where we had more patients that needed a respirator than we had respirators? No. There was a couple times where it got very close to thinking, okay, how are we going to manage this? But we never had more patients than respirators. So we've been able to manage it very well. We've been, I don't want to use the word creative to say that, you know, we were cutting corners in any way, but we took a lot of safeguards to make sure we were always prepared. So it's been safe.
That's great.
Good to hear.
So we know you have a love of cycling, and we used to see you at 6 a.m. spin classes regularly before COVID. How have you adapted in the pandemic to, when the gyms were not open?
So I bicycle. I do cycle quite a bit. My son and I, the second week in September, did a double century. so 200 miles in a day.
Oh my goodness.
I have really good lights on my bike, and so probably more like 3 or 4 times in the week, I'm out in the dark in the morning. People say it's not safe, but I don't know when else to do it. So
Oh my
Yeah.
goodness.
that's how I've adapted. Is I have bought really good lights.
Bright lights.
Bright
So if we
lights.
see the
Good.
if we're out in the
Good.
morning and we see a glow on the side of the road, we know to give
Yeah.
space.
Lots of red blinking lights. So
Wow. Well, if you're ever around on a Saturday, the gym does have an outdoor spin in the parking lot that I'm going
actually, I've now pulled up twice in the morning and waved at Marguerite in the morning as
Oh,
I went
cool.
Oh,
like-
that's awesome.
down. So no, I've
That's
seen you guys
awesome.
out there.
Yes, good.
Well,
Good.
you have a high stress job, and that is a key way to maintain mental and physical health.
For
So
sure. Yeah.
yeah. Well, we really appreciate you coming on and chatting with us a little bit about the current goings on at the hospital and personally. So we appreciate your time, Ken.
Thank
Yeah.
you so
No,
much.
anytime I can talk about the hospital. I will say that the hospital is an amazing gem. If people really realize how good, especially Arroyo Grande Community Hospital, how good the care is, how good our surgeons are, the uniqueness of like the acute rehab. It really is a really good general acute community hospital. So it's
I agree. We've had causes to visit the ER. One year was particularly frequent in particular, and everything from some very, very extensive and intricate cosmetic stitches that you wouldn't think you would get in an ER, and you can't even tell my mom has them on her forehead. Everything from that to other things, everything was a great experience, so much so that she wrote like a letter of glowing review to maybe you, I don't know, somewhere she had to send it off to say how good her experience was. So I think that we do have a gem that it's right here in our little community. So
yeah. Anyways,
thank
so
you.
thank you for the opportunity to talk about it. It's good.
Yeah,
Thank you so much.
we'll see you soon.
Okay.
Bye,
Have a good one.
Ken. Thank
Bye-bye.
you.
This is Ashley Boyer.
Jordan Ham
And Shannon Bowdy.
with the Pismo Beach Homes team.